striking health workers defied a High Court directive to end the strike.
That's right. We've got Patrick Amimo, who has the situation in hospitals on day 3 of the strike, and he's going to tell us about that now.
Operations at various public health facilities across the country remained paralyzed for the 3rd day running as health workers continued with their strike. Murang'a County government has bought 8 ambulances to help in transporting patients who are critically ill or in need of emergency services to private hospitals. This old man at Kangundo Hospital waited for treatment only to be welcomed by an unmanned facility. Maybe he never knew health workers were on strike, or maybe he thought they had resumed work after the High Court declared their strike illegal.
Uhuru na Ruto, mungekaa chini, tafadhali mtusaidie. Juu tunasikia uchungu watoto wakiteseka na wamama wajawazito, watoto wadogo pale maternity.
The Union of Kenya Civil Servants has urged the striking health workers not to risk their jobs by not resuming work.
Civil servants from the Ministry of Health who are members of our union are participating in unprotected strike because the union representing them never called for the strike. In case of any eventuality, we might not have opportunity to defend them. There are some senior government officers in Ministry of Health who don't want to come down and serve the people of Kenya, and are the people who are behind this strike.
The striking health workers are opposed to the devolution of health services at county levels.
If we are serious, we want health bill to be in place, the strike ought to have been called in February when MPs have resumed.
This strike is completely uncalled for. It is touching on a matter that is beyond the governors.
Bomet Governor Isaac Ruto issued appointment letters to 100 new medical personnel and posted them to various health facilities in the county to alleviate patients' suffering.
On secondment and they refuse to work, they revert back to national government. Then
most of the medical staff think that they will be paid out of the local revenue that is being collected from the county government. But this is not so.
In Uasin Gishu County, the governor threatened to close down all private clinics owned and operated by medical practitioners who are on strike.
I am directing my enforcement team, together with the county executive in charge of health and the director, to shut all clinics, dispensaries operated by public health workers in a government payroll with immediate effect.
Sababu haya mambo yameenda kotini, hao warudi kazini, wangojee uamuzi wa koti.
As Kenyans marked the Jubilee anniversary, the sick in public hospitals who could not afford private health care did not have anything to smile about or celebrate. The health workers' representatives have not said when striking workers will resume work. Patrick Amimo, KTN, Nairobi.